What have we learned about the quality of life, what matters to people, and about outcomes? You're going to see a lot of what you expect to see, and some things you don't. There are some surprises in this data. I found 5 trends that I want to talk about, 5 things that matter. And with each one, I'm giving a little bit of thought to what that means for the Arthritis Foundation. It's early thinking. We have a lot more work to do on it, but we'll start talking about that. First thing that matters, this won't be a surprise. If anybody would be surprised that pain matters, obviously a hallmark of arthritis is painful joints. Physical pain is a big deal. When we quantify it, we find out that the average person with arthritis has pain the number of days in a month. The average number of days in a month is 12 days. 80% of people with arthritis have pain at some point during the month severe enough to impact what they want to do. Going to work, going to school, taking care of themselves. About a third of the people have pain at that level every day. We need to realize that the pain of arthritis is much more than physical. Physical's real, it's a big deal, but there's a lot of emotional and psychosocial pain that goes along with arthritis as well. So a question, this was a validated measure, it's used widely in psychology to diagnose depression. And the question was, over the last 2 weeks, how often have you been bothered by the following problems? Little interest or pleasure in doing things, feeling down, depressed, or hopeless. These are the average numbers. People with arthritis, more than half of the people say they're feeling little interest or pleasure in living life and doing the things in their life every day. Next, what does this mean for us? We need to expand our definition of pain. And know when we talk about pain, it's not just sore joints. We do need to continue our focus on physical pain. We introduced a new online Breaking the Pain Chain toolkit, and we've got a number of resources. A lot of our gatherings through JA and arthritis introspective groups, and I'll talk about pain. We've got to keep doing that. But it's really imperative that we develop an action strategy for the emotional pain. The next thing that matters is medical outcomes. People want to live better. They want better health outcomes, health status. They would love to go into remission, right? That's a possibility. When you ask people, open-ended question, if there was a new treatment, what is the one single thing you would want that treatment to do for you? Pain's number one, so that validates the first finding we talked about. But look at the others, which also had really high scores here. Increasing overall health, slowing disease progression, preventing joint damage. We have the ability to bring patient-reported outcomes into the mix, make sure that voice of the patient is reflected and heard and incorporated in it. Improving doctor-patient communication, shared decision-making, as I mentioned, and you'll hear more about it tomorrow. The next thing that matters, again, this will not surprise you, access is a big deal. People with arthritis are dealing with a lot of barriers to their access. And even if they have a good practice, a good team, good insurance, they're dealing with a lot of things that make it difficult to get the drugs they need. So we're trying to first ask questions, really figure out what are the things that are happening. And here's what we're really trying to do, is figure out what are some short-term and mid-term things we can help lead to make a difference. What are 5 things families can do now, soon, to help themselves with their challenges? What are 5 things the Arthritis Foundation can help lead to change in the broad system next year? It's big and it's ambitious. It's another place that we're going to be a leader, and we're trying to do it in a way that is fair and comprehensive and doesn't point the finger at any one group, because this is not a one-group problem. You know, having arthritis can suck. It can make the simplest things really hard. It can make the things that are hard anyway almost impossible. That's not acceptable. So one of the things we did this year, we asked people, what do you find difficult? You're living with arthritis. What are the tasks that are difficult for you in your daily life? Getting dressed. Almost half the people have trouble getting dressed. Climbing in and out of bed, 47%. Picking something up off the floor, 54%. Getting in and out of a vehicle, 68%. Those are things we do pretty much every day. And that, of course, leads to what does that mean for us? Well, one thing it means is we need to continue our focus on ease of use. I hope most of you know we have a very well-established, long-running ease of use program in which an independent research lab evaluates products for their usability, including having people with arthritis test them. The director of that institute is here and will be involved in some of the later sessions with some of the groups. We need to continue focusing on that because that's a way that we can recognize the companies that are working to make their products easy to use. But we also think we can take a more proactive approach. Instead of just recognizing those that have done it, we should be influencing the broader world of manufacturers to make their products easier to use. Again, that's not going to be an easy hill to climb, but it's something we think that we're probably uniquely able to do. The other thing is just in the way we talk to people and what we talk about in our content and that kind of thing, just advice, tips. Sometimes it's that person-to-person advice. It's really being able to talk to somebody else and hear what's worked for them, their little life hack, which leads to the last thing that matters. And this is a biggie, connections. You know, we talk a lot about, at least historically in the foundation, the power of what we do is in the content or the information or the programs or the activities. But a lot of times it's really in bringing people together. 58% of people with arthritis say nobody understands how arthritis pain affects me. What if you never met another person who understood what you're going through? Think how lonely and isolating life would be for you. We think what this means for us is clearly we've got to continue focusing on connecting people. That was a big part of why we did merge with Arthritis Introspective, why we elevated JA to a pillar. That's still leaving a lot of people without the connection. So we're thinking about that. I mentioned the camps, conferences. Right now we're at over 50 camps, over 100 family days, and 2 conferences because we outgrew one. It's a good thing. The Arthritis Support Network I talked about. And we do have a virtual online community. You can access it through arthritis.org. If you haven't checked it out, check that out as well.